My name is Natasha Mendoza. I'm an associate professor in the School of Social Work at Arizona State University. I'm also the principal investigator of ASU's State Opioid Response Grant at the Southwest Interdisciplinary Research Center. This grant is made available through the Arizona Healthcare Cost Containment System and the Substance Abuse and Mental Health Services Administration. With the support of AHCCCS and SAMHSA, we launched Project MATTRRs, or Medication and Treatment Technical Assistance for Recovery Residences. We've had the opportunity to learn from recovery home stakeholders from across Arizona, and we identified some important needs related to education and technical assistance. Specifically, we learned that there's room for growth around medication for opioid use disorders, state regulations for sober living, and programmatic issues related to policy, development, and sustainability of recovery homes. Moving to the next phase of Project MATTRRs, we look to our community-based providers to help us convey the importance of knowledge related to medication for opioid use disorder and competent and quality management for recovery homes. Over the next few minutes, we'll hear from Dave Sheridan, the Executive Director of the National Alliance for Recovery Residences. He'll highlight the importance of medication for opioid use disorder for those in recovery homes. We'll also meet Jeff Marsh, the Executive Director of the Arizona Recovery Housing Association, as he presents the importance of quality operations. And last but not least, we'll hear from John Whitaker, a recovery home manager who will stress the importance of having a strong management skill set.
I'm the Executive Director of the National Alliance for Recovery Residences, or NAR. The first thing we do is that we maintain a national standard for recovery residences and a code of ethics that goes along with that. And that defines the basic operating parameters and physical characteristics of a residence that applies across a fairly broad spectrum of recovery housing, from pure peer-operated residences such as Oxford houses, all the way through the service continuum up to, and in some cases including, clinical treatment programs. We do have a fairly substantial role in helping providers address a variety of challenges having to do with the operation, and often with collaboration with state and federal public health initiatives. And you mentioned medications. So medication-assisted treatment has been a real keynote piece of our address to the opioid crisis. And it's a contentious issue in a lot of recovery housing circles. Many providers who view themselves as strictly abstinence-based are really opposed to accepting residents who might be prescribed medications that are opioid-based, even for treatment of an opioid, so methadone, buprenorphine. Our policies are sort of two-sided. One directed at state efforts to implement those kinds of programs, prescribers, utilization in programs, and the other is education and support to providers. Boy, I could make a list that's probably 8 or 9 things long, but really at the very top is training and best practices for operating quality residences, independent of a residence's recovery pathway. So how does a new provider develop written policies and procedures? What's the appropriate way to select and train and support the workforce, which is often a peer-based workforce? Other things that are really important, because we get a lot of inquiries, would all fall into the general category of business skills.
Hey, my name is Jeff Marsh. I'm an operator of sober livings in Arizona. I have 2 houses in Chandler and Gilbert. I'm also the executive director of the Arizona Recovery Housing Association. The Arizona Recovery Housing Association is a group of sober living operators in the Valley that strive to adhere to national standards that are exemplary for sober livings. One positive thing I've seen locally is that cities are becoming more accustomed to having sober livings in them, and they're making ordinances that are favorable to sober livings They're not fighting back as much anymore because we are a protected class, and under Fair Housing Act, we are allowed to be living in a congregate place together in a single family unit. And still, some cities are not quite favorable to us, and we still have some neighborhoods and HOAs that do not want anything in a recovery housing in their neighborhoods. However, we as a sober living, if we're operating dutifully and doing the right things and licensed and operating correctly, then we are probably one of the best neighbors in the neighborhood. It's a group effort, right? As most people know, especially in the recovery, it takes a village, not just single people. So we offer support, continuing education, news, updates, state and national level updates of what's going on in the recovery industry, training, all that stuff.
My name is John. I'm the director of Sober Living here in Arizona. And my role is, as a director, is to make sure everything in the house is running well, the infrastructure, the needs of the house, anything necessary to keep the house running. I also manage and work alongside with a house manager that we have here within our house, who does more of the day-to-day tasks that have to do with managing our residents, working with our residents, and making sure that everything in the house goes by and works well. What you need to be a house manager, really, it's hard to describe, because you're living in a house with many other people. Could be smaller groups, could be larger, depending on the sober living in which you're involved with. But it's learning along the way about people, about relationships, about management. A lot of folks aren't used to, let's say, managing other people, how to manage people. Just as an introductory course, because a lot of people, again, thrown into this, don't understand kind of the touchy-feely side of themselves on how to be able to manage a large group of people without being, horrible, or without being overbearing on people. It's a definite skill that I think a lot of people that are house managers don't quite get, but I think they learn over time. Even having the most basics of this is what you can expect as a house manager, I think would be super helpful to a lot of them.
In partnership with NARR and AHCCCCS and multiple recovery home personnel, we now turn our efforts to creating the Recovery Home Academy, which will be a means to educate owners, managers, and peer staff on best practices in recovery home environments. We are completely committed to developing new ways to support healthier communities in the face of Arizona's opioid crisis. We're excited to tell you more about this venture in the coming months. Thank you for your interest in our work at the Southwest Interdisciplinary Research Center.